asking if anyone has any declarations of interest, please. No? We'll take that as no then. Can we move on to item 2 then, which is the minutes of the previous meeting? Has anyone any issues with the factual report of those minutes? No? Then we'll take those as read. Thank you. And move on to Ashlyn, who is deputising for Paul, who is away on leave today, and ask Ashlyn for her local outbreak and evacuation plan update, please, Ashlyn. Thank you.
Okay. This will be quite brief as well. Again, would like to thank the population and visitors of the Isle of Scilly for their continued diligence to public health measures. I think those of us who are away over half term, we also found it noticeable how much more conscientious people are in the Isle of Scilly compared to lots of other areas across the UK mainland. And of course that is reflected in our case rates, which are, we have to learn to live with it, and it is around, but we are really doing excellent work in terms of preventing onward community transmission and keeping services going. You're all aware of the evacuation plan, which was an economic measure to make sure that the island's prosperity wasn't harmed through this outbreak. We have, in the last period since we last met, we've done one evacuation. It was the most sensible thing to do. Everything's risk assessed on a case-by-case basis with our colleagues in public health, and that was the most appropriate action. And in terms of budget, that sits well within the pot that we set aside in order to support the economy as a wider partnership. And I think that's it from now. Booster jabs, I don't know if that's later on the agenda, but I'm happy to talk about it here. But the health centre, as usual, are on top of this. So they have been offering everyone their booster jabs. Our most vulnerable have been offered it already. Everyone in Park House has been done. As you know, from the 11th of January, nobody can work in care who hasn't had double jabs, and that's all in place. And 12 to 15-year-olds have been done or been offered, and the flu jab has also been offered to all of those most vulnerable. So in terms of getting needles in arms, our health centre continues to be absolutely fabulous, because as Dale will tell you, nobody can say no to Fran.
Very true.
Yeah. I think that's it, unless there's any questions.
Thank you, Ashley. Has anyone any questions or follow-up asked from Ashley this morning, please? Right, I'll take it that there isn't then, and move on asking Dr. Whitney Curry if she would give us her Director of Public Health update, please.
Morning. Thank you, Chair. So, as of yesterday, we had, in terms of our case rates, and Cornwall and Isles of Scilly are lumped together, as you know, we were at 407.5 per 100,000. The week before that, we were at 410.8 per 100,000. So, still steadily coming down, following suit with most areas in England, actually, at the moment where we're seeing cases come down. Southwest was at 508. Devon, we're sort of under Devon's rates and Plymouth rates as well. So we benchmark ourselves against our neighbours. Across Cornwall and the Isles of Scilly, our case rates are higher amongst the 0 to 15s, which I don't think will surprise anyone. We've got kids in school mixing around, and that's where we see most of it. But what happens from then is the fallout in terms of household transmission when kids come home and pass it on to their household members. I think that's why I will reiterate again, and I know Ashley has done a great job of this, is that if you haven't taken up the offer of the vaccine, it's really important. And for those who have been double jabbed and triple jabbed now, it's still really important that we continue to do those prevention measures, because it's here, we have to live with it, but the more we can limit the spread, the less likely we'll have a variant of concern, and that's really what we're looking at. That's what we're always looking out for at the moment. The vaccines are incredibly effective at preventing severe illness and death. Boosters are even more effective, and we've done such a great job for Scilly in making sure we get those to the most vulnerable. But they do actually cut transmission by about 50%, and that is with Delta variant. So it's really good, and the more we can suppress that, the less likely we can have one that will beat our vaccine. So really, really superb job. Other things that are important to update you around are Plan B. So you will have known that the government have their autumn and winter plan for COVID, and Plan B was sort of the next step in terms of adding any other restrictions in. We are not at Plan B status at the moment. I know this has been in the media quite a lot, and we don't have any indication that we're going that direction at the moment. It really is a watch and wait, because we do see case rates coming down, but we also know the NHS is continuing to be strained, not just by COVID, but by everything else as well. Winter illnesses are starting to kick off, flu, RSV for children, pneumonia. So we are keeping a watchful eye on our NHS. Twice weekly lateral flow testing is still really, really important. So I know there's fewer people around the islands. We don't have as many visitors coming back and forth, but it's really, really important that you continue your asymptomatic twice weekly testing. So this is no symptoms, but test yourself twice weekly, and this will really help us catch cases early, and then get that confirmation PCR if you do end up being end up being positive. I'll pause there and see if there are any questions, and then Sheriff, if you want me to go into testing, I can do that as well.
Whitney, can I just ask, is there any news on second jabs for 16, 17-year-olds yet?
Not yet. I think the direction of travel, if we look at other countries, they have done second jabs, and we have tended to follow a similar trajectory as other countries in terms of looking at their data on effectiveness of the jab. So I wouldn't rule it out, and we're keeping an eye on what's going on elsewhere in terms of 12 to 15s as well, as those are rolling out in other countries on a very large scale.
Okay, thanks.
Thank you. Any other questions or comments on the first part of Whitney's update, please? No? Right. Yes, please do carry on, Whitney. That'd be lovely.
Okay, great. Lovely Abby Wrigley, who is normally our testing lead, was unable to attend today, so she's given me an update for you. What's I think the most important to note is that Silly for a long time hasn't been part of the national testing program. We've had our own sort of local testing, enhanced testing service through RCHT, which has been great, and we really appreciate it. We want to make sure that Silly actually has the same access to testing that anywhere else in England does. So Abby and colleagues have worked really, really closely with DHSC to make sure that we can have access to that national testing. So that's postal tests that you can order and receive those. At the moment, we do have those tests. You can't order them on the national website yet. We used to be able to do it sort of intermittently. Some of you might have seen in the past. But we're still waiting on the national team to update the website to order it. But so for now, we have the national tests, but you still have to get them through Keep Silly Safe, just so everyone knows. But the tests are here. They're great. Pop them back in the post. And our post office colleagues have been absolutely critical in getting this off the ground. And I really thank them for being flexible and understanding with us, because I think that's a really key component moving forward, is having access to that testing when and where we need it at any time, moving through what could be a rough winter as we see other illnesses flying around. So really important to note that we are in the loop now for that national testing, which is good. Should note that our PCR testing really ramped up over the summer. I know we all know that. In August, we were doing something like 40 PCR tests a week, and by October, it's more like 10 or 12. So we're seeing fewer symptomatic people. We're seeing visitors now, is my understanding as well. So we won't necessarily see maybe cases coming in as before. But in terms of residents as well, we're seeing fewer symptomatics. Abby wanted to make sure we reiterate that LFD testing, so that asymptomatic testing is still available and supported by DHSC, and she still has those 2 drop-in sessions available every week where members of the public can pick up LFDs. You can still order them online, and they usually, I guess, pending weather for you guys, usually come in about 24 hours through the post, but you can also pick them up at the pharmacy, and we're in touch with our pharmacy colleagues about if they ever have any supply issues, or we just make sure that we all know if there's anything that they need. So that's it around LFDs. I do encourage you to continue taking up that offer and continue to test. We've got lots of snotty colds, coughs, fevers. DNV is starting to go around everybody. Be aware. So it's really good to keep that testing, so you can start to rule out things like COVID, and you've just got snotty colds or things like that. So do make sure if you've got any symptoms, any wide symptoms, I don't care if you're not sure if it's a COVID symptom, you can still request a PCR test. We're very happy to make sure that testing is available. No symptoms is an LFT. What I would say is keep up the prevention as well. I was saying DNV is going around. It's no joke. And DNV doesn't go away when you just use hand sanitizer. You've got to wash your hands. And that's something I think maybe we've gotten a lot used to as we squirt some hand sanitizer when we go in and out somewhere. Maybe we don't wash our hands quite as often as we have previously because hand sanitizer is everywhere. But just really reiterating that COVID isn't going to be the only bug going around for us this winter, and we just want to make sure we keep each other as healthy as we can moving forward. That's it. Any questions about testing?
No questions? Thank you for that update, Whitney. I think the fact that we've been safe is appreciated by all of us, but the message that we can't be complacent, especially when people are increasingly going off island now as we come to the end of our season, is really, really important. And I expect when we next come to our communications update from Tom Walton, Tom will be very anxious that we carry on putting out that message loud and clear. So thank you very much indeed. So if no one's got any other questions for Whitney, we'll move on to Tom, please, and communications update.
Thank you for that. So we recently put out a public health message on 3rd of November, which was a general local public health update. It covered mainly vaccinations and boosters, which are obviously, as Whitney pointed out, vital to prevention measures and massively reduce the risk of severe illness from COVID. It's actually something the Cabinet Office are really keen on promoting, so they're pushing boosters in particular at the moment, really encouraging people to get them, because there's a sense, certainly nationally, in which people who've had the first two vaccines aren't sometimes going on to get the booster, but it is really vitally important that they do that. So they're really pushing it, and we obviously want people to do that locally. Something to note is the Health Centre have actually got their own Facebook page now, so that's a good additional source of information on boosters and vaccines. They give updates about when you can expect a phone call on that, etc. So if you're on Facebook, it's worth following that. Whitney mentioned it just before. There's slight additional change to the local guidance on when to get a PCR test. So obviously the normal COVID symptoms, but additionally cold symptoms, and we put that in the recent update as well. In terms of additional communication effort, we're obviously keeping our ear close to the ground because there's lots of updates from government at the moment, and there's talk about the need to really follow prevention measures leading up to Christmas, so there aren't any additional restrictions around Christmas. So it might be that there's more comms around relating to that, but nothing at present. And that's the update from me for now.
Thank you, Tom. Has anyone got any questions after Tom's update, please? Comment?
Chairman, just for the sake of the minute, what's DMV or DMV?
Sorry, diarrhea and vomiting.
Got you. Sorry.
Not knowing.
Don't.
Right. Just then, if no more questions for Tom, if I could just ask, just before we close the meeting, if Whitney could just, at the beginning of the meeting, before some people joined, Whitney was just explaining what the current position of this board is, which is that I think we hold a watching brief. But if you could just explain that quickly for us, Whitney, that would be appreciated before we close. Thanks.
Sure. So local outbreak engagement boards really are owned by the local area. So it is up to you how you want to mould and shape it. But I have recently been speaking to other local authority areas, so Cornwall and many other areas in the southwest. And at the moment, everyone is holding their local outbreak engagement boards and to see them through the winter. We are waiting a bit on what testing is going to look like moving through the winter and probably post-January, and what outbreak response might look like at that point as well. There's quite a lot of changes that we might expect to see after the winter or after January, really. So other areas are holding. So I think it's probably for us to consider that, whether we want to continue this and hold as well, rather than changing anything just yet. So that was the discussion kind of at the beginning.
Thank you very much. I think that sounds a very sensible idea. Ashley, would you agree?
Yes, absolutely.
That's what we will consider we're doing at the moment then. Right, just leaves me to thank everyone for their time and contributions this morning.